So in the previous video, we had discussed regarding BUG dilators for esophagus. In this video, we will be discussing regarding balloon dilators. Classically, it is known as through the scope balloon dilators. The slides were prepared by Dr. Manoj and I have modified it and I will be narrating it for you in detail. Regarding through the scope balloon dilators, there are two types of balloon dilators. One is classically we all call it as controlled radial expansion balloon dilators. Second is the fixed diameter quantum through the scope balloon dilator. So all of you will be familiar with CRE, but I doubt will many of us be familiar with the term quantum balloon dilators. In this video, we will discuss both of them. In short, it is balloon dilators. So the controlled radial expansion balloon dilator, the CRE, is actually produced by the Boston Scientific Company. So what it actually does is that it has a special material which allows three different diameter dilatation with a single balloon dilator. It provides radial vector forces so that dilatation happens. It has an atraumatic tip. This is an atraumatic tip and this is the balloon. And the total catheter, it is 180 centimeter long for the CRE balloon. And CRE is for a trade name for the Boston Scientific Company itself. And the balloon length is fixed and it is 8 centimeter balloon length, which we use for esophageal ones. It is 8 centimeter balloon length. And the shoulders, what you see, they are rounded shoulders and they help in endoscopic visualization. Once it comes out of the endoscope, it helps in visualization. And the endoscopic exit marks are also there, which will help us to know there is complete exit happens. And regarding the material, this CRE balloon dilators, this balloon is made of a special material known as PBAX. PBAX means polyether blockamide. Polyether blockamide or PBAX is a material used in CRE by the Boston people. So the advantage is that it is actually a thermoplastic elastomer. It has a durable material and it is non-compliant, or we call it semi-compliant also. What happens is that there are three distinct diameter can be produced by this single CRE balloon. So based on the pressure what is being applied, there will be three distinct diameter can be produced and there won't be wasting. Without wasting, based on the pressure, that particular diameter can be achieved. That is why it is known as polyether blockamide. It is a special material which is used for the catheter and for the balloon. And these are the parts. So in the parts of the CRE set, we have the alliance gun is there. This alliance gun can be multi-use. This is the alliance gun. In this alliance gun, we know this is the back is for aspirating back, and forward if you put to the green color, if you put it can be, and if we put it to front and if we plunge it or if we load it or press this one, the water will be going, water or the contrast material will be going out. And this here in this gauge we can see the pressures, and this is for guide wire and this is for guide wire. And the tip, we have the balloon, and this is the non-traumatic tip, and this guide wire will be coming out. So the diameter is measured in mm or in French. 3 French is equal to 1 mm. We should remember. And see, this is the classically in Boston balloon CRE balloons. This will be the box or this will be the cover which is shown. And here what you can see, there are three diameters can be achieved in this. And for this it is 10 mm, 11 mm, 12 mm can be achieved. And for achieving that, how much ATM pressure is to be applied is also given here. So it is 3 and 8. So if we give 8, it will be 12 mm dia will be achieved. So based on this, after introducing the balloon across the stricture, we can inflate up to that particular ATM, and so that fixed diameter will be achieved. So three serial dilatation can be achieved with this. So this is the common sizes which is available for esophageal balloons in case of CRE of the uh, Boston company. So we have size ranging from 6 mm till 20 mm. So and what to understand is that in each balloon set, only three particular serial size will be achieved. For example, 6, 7, 8, 18, 19, 20. So if you need to achieve a 12 mm diameter, you should ask for an balloon set which has 10, 11, 12. Or if you want 15 mm dia, we should ask for 12, 13.5, 15 mm, or 15, 16.5, 8 mm. So what you see is that to achieve 6 mm dia, you should give 3 mm ATM pressure in that particular set. Why I tell in that particular set is that as a set changes, the pressure for that particular set will be changing. So you should look into that description how much pressure, ATM pressure, is to be given to achieve that particular diameter. So in this particular balloon, for achieving 20 mm, you should give only 6. While if you come to this balloon, you see that you will have to give 8 mm, 8 ATM to achieve 15 mm. So three incremental diameters can be achieved with a single balloon. So advantage is that you need not always remove it and remove out and in. For a complex esophageal stricture, you can use this balloon so that at multi-level you can use for multiple dias. The technique is that the stricture under visualization we should be noted, and the length of the stricture distance from the upper esophageal sphincter should be measured. So through the scope, after lubricating, you can through the guide wire, you can keep a guide wire, and through the guide wire you can introduce the CRE balloon, or even without the guide wire also you can introduce. Commonly practice is through the guide wire it is being introduced, and gradual inflation of the balloon is done using the alliance gun which I showed you, and using water or diluted contrast you can use. So to prevent proximal or distal migration of the balloon should be done, and the balloon should be kept in the center of the balloon should be at the level of stricture, and assess the stricture through the shoulder of the balloon. Through the shoulder of the balloon you should assess perpendicularly. If you have seen the procedure you will understand. And once required dilatation is maintained, it should be maintained for 30 seconds to 20 minutes time. So if the mucosal tear is noted, or if we can achieve 2 to 3 diameter of balloon we have expanded, that should be the end of the procedure. And scope and the balloon together, after dilatation is achieved, it should be advanced further forward. Along with the balloon, along with the scope should be pushed inside. After that, a check endoscopy should be done after removing the balloon. So this is the full set that you can see. We see the guide wire passed and the balloon is being inflated, and we see the stricture has been opened up. So the end point of esophageal dilatation is there is no specific guidelines. For solid food, 12 mm is more than enough. For regular diets, for all regular diets, if you want to achieve 18 mm, but commonly at 12 mm or 13 mm we use to stop the dilatation procedure. Complications due to dilatation is bleeding, so tachycardia or hypotension we should see. 0.2% perforation can happen. In those cases, chest pain, crepitus, neck pain, or respiratory distress, mediastinitis will be there. Aspiration pneumonitis, cough, and expectoration can be there, including bacteremia can be there. So antibiotic prophylaxis should be given for dilatation cases. One discussion in CRE what is pending is regarding wire guided CRE versus fixed CRE. Fixed wire CRE. Wire guided CRE means it is a small balloon and through which a guide wire can be passed. It is useful for a complex strictures where guide wire can be passed and through it which we can pass the balloon. While in a fixed wire CRE, what we see is there will be the guide wire will not be passing across the balloon. So the fixed CRE balloon, fixed guide wire CRE balloon, fixed wire CRE balloon can be used for simple strictures like a esophageal stricture where it's not complex. We just want to introduce the balloon inside and dilate it. The wire guided one, it will have a double lumen catheter for injecting the contrast material through the guide wire port also. And it can be used for tortuous strictures or for sphincteroplasty also. It can be used. It can also be used in biliary cases. We use this wire guided one. So this simple concept we should remember. Now we will discuss regarding the second type of through the scope balloon, that is quantum balloons. So this is produced by some other company, that is Cook Medical Company. So this difference between CRE is that in CRE we know with a single balloon we can achieve 3 serial dilatations. While in fixed one with a single balloon we can achieve only that single dilatation can be achieved. So 10 mm, 12 mm size is the 14 mm size is the 16 mm size is the 18 mm size. So for a 10 mm balloon we can achieve only 10 mm dilatation. So difference is that this is actually the length of the balloon is same 8 centimeter for esophagus. It can also be used for colon also. So the length is almost 5.5 centimeter length. So of the balloon for the colon one. Esophagus it is 8 centimeter because complex strictures can be the you can be using it. While total length of the catheter in esophagus it is 195 in this balloon, and if it is for colonic one you have 240 centimeter length can be length is the for the catheter. So for a terminal simple strictures you can use this case, and it is a low compliance polymer balloon is being used. So this is the difference between CRE balloon dilator and quantum balloon dilator. So CRE balloon dilator, as discussed, it is multi-dia 3-in-1. Quantum is single fixed. Quantum is from the Cook and CRE is from the Boston. Length of the catheter is 180 centimeter, while in quantum it is 195 centimeter. The shoulders in CRE is actually round. In quantum it is square shaped, what I showed. And the material is Pebax material, which is dilatable material for CRE, and this is actually nylon 12 material. The mechanism is size changes with the ATM, with the pressure, while in quantum it is fixed size. So number of balloons needed, only one balloon is needed for three sizes, while in quantum you need multiple balloons. Controlled one, it is graded, and the control regarding CRE, it is graded one, it is step by step. That means after one balloon, if we feel it is not dilated, another balloon should be introduced. For complex stitches, actually CRE is used. For a fixed stitches, simple type, a quantum can be used. Cook medicals can be used. For colon or terminilium, you should use a quantum one because the length is not adequate. CRE is used for esophagus. Can a biopsy be done before dilatation? This is a discussion we had in SG dilatation also. Traditionally, we tell biopsy should not be done before dilatation. It can cause perforation, but there are controversial studies which tells that there is no increased risk for perforation. So this ends regarding CRE and balloon dilatation. Next, we will have a video regarding comparison of SG dilatation and balloon dilatation. Thank you.